When do healthcare professionals need prior authorization for Medicare services? Breaking news for those navigating Medicare. The question on many minds right now is, when do healthcare professionals actually need prior authorization for Medicare services? If you are a patient or provider, this information is essential. Let's get into the details that matter most. Healthcare professionals must obtain prior authorization for certain Medicare services as required by Medicare rules or Medicare Advantage plans. This process involves requesting approval from Medicare or the Medicare Advantage plan before providing specific services. The goal is to ensure coverage and confirm medical necessity. Currently, traditional Medicare requires prior authorization for a limited number of outpatient services. This includes some durable medical equipment and repeated non-emergency ambulance transport. These prior authorizations are managed by Medicare administrative contractors. Recently, the Centers for Medicare and Medicaid Services announced plans to expand prior authorization requirements. Starting in 2026, this will be done through new models like the Wasteful and Inappropriate Service Reduction model. This model targets services that are often overused or improperly billed. It will involve third-party contractors using artificial intelligence and clinical review to manage prior authorizations for selected services. Medicare Advantage plans often have their own unique prior authorization requirements. For example, earlier this week, UnitedHealthcare, a major Medicare Advantage insurer, announced changes to ease prior authorization burdens. They will now allow up to 6 follow-up visits for physical, speech, occupational therapy, and chiropractic services without prior clinical review. This change aims to reduce delays in care for Medicare Advantage members. So, when do healthcare professionals need prior authorization for Medicare services? They need it when the service is on a list requiring it under traditional Medicare or Medicare Advantage. Additionally, if the Medicare Advantage plan's policies mandate prior authorization for the service, that applies too. Finally, services subject to new models like Wasteful and Inappropriate Service Reduction will also requiring prior authorization. It is important to note that failing to obtain the required prior authorization can lead to claim denials or delays. Therefore, healthcare providers must verify authorization requirements before delivering services to Medicare beneficiaries. This knowledge is vital for ensuring timely and effective care. Stay informed and prepared as these changes unfold in the healthcare landscape.